Ayubowan Vanakkam. This brief video clip provides advice on how to look after your mental health and well-being during the COVID-19 pandemic and is presented on behalf of the Sri Lanka College of Psychiatrists. We in Sri Lanka, as well as all over the world, are facing a very challenging time, which I feel has turned our lives upside down. In addition to the fears of contracting the COVID virus, worrying about people close to us who are vulnerable, and the restrictions imposed to contain the virus has changed the way we live, work, and communicate. Some of us might be feeling anxious, overwhelmed, confused, sad, or even bored. In such a situation where there is uncertainty and perceived threat, it is normal for us people to feel like this. However, these feelings can take their toll. Therefore, it is important that we are aware of feelings and know what we could do to look after our mental well-being and that of family, friends, and colleagues. So what can you do to look after your mental health and of others during this period and make us feel more in control of ourselves? To maintain mental well-being, we need to rise above the virus, RISE, to improve mental well-being, which stands for routine, information, social connections, and exercise. Have a routine. Keep up with daily routines as far as possible or make new ones. Have regular times for waking, going to bed, meals, exercise, work, recreation, and time with your family. Keep informed. Keep up to date by listening to advice and recommendations from the local authorities and follow trusted news channels on TV and radio. However, make it a point to seek latest information at specific times of the day only. Social connections. Remember to maintain social connections. Talking to people help us feel safe and well. You can still keep in touch with family and friends using phone calls, video chats, online groups. Even short chats with neighbors is possible if you remember to wear a mask and maintain the 2-meter distance. It is normal to have ups and downs due to uncertainty. So talk about how you feel with family and friends. Remember, in times like these, they too are likely to experience similar feelings. Exercise. Look after your physical health. Exercise, eat healthy, and get adequate sleep. This will help us stay physically and mentally healthy. You can still stay physically active whilst following physical distancing rules. If you're unable to go out to exercise, do a few exercises inside the house. Remember to get some fresh air on a daily basis. Finally, seek help or support. If you're feeling anxious or depressed for an extended period, seek professional help. Call a hospital mental health clinic or dial 1926, a 24/7 hotline for further advice. Remember, doctors and other healthcare providers also consult via video or phone. A few things to avoid. Avoid using tobacco, alcohol, and drugs as a way of dealing with fear, anxiety, boredom, and social isolation. If you need help with stopping or cutting down, speak to your doctor or call the helpline 1927 of the National Dangerous Drug Control Board. Avoid being inundated with news and information. Try to reduce the quantity of news you watch, read, or listen, especially if that makes you feel anxious or distressed. Seek the latest information at specific times of the day, once or twice a day if needed. A bit of advice for groups with additional mental health needs or facing specific issues. If you are being treated for a mental health condition, make sure that you continue to take medication as prescribed. Government hospitals have made arrangements for clinic attendees to get the monthly medications delivered to their residents. Keep in touch with people who care for you and know who you can contact for support if your mental health declines. If you're being treated for an alcohol or drug use disorder, be aware that COVID-19 outbreak may lead to increased feelings of fear, anxiety, and isolation that can increase the risk of relapse, substance use, disengagement from treatment, or non-compliance with treatment regimes. Make sure that you continue to take medication as prescribed. If you're receiving support through a psychologist or support group, find out how to continue that support during the outbreak. If you do not feel safe at home, there is help and support available to you. Abuse is unacceptable in any situation, no matter what stresses you or others are under. If you are in immediate danger, call 119. For further advice, call the NIMH hotline 1926. We Sri Lankans have overcome many wars in the past, so let us unite to fight this battle with COVID. Stay safe and healthy, and remember, RISE, R-I-S-E, to improve mental health. Thank you.